Hey everybody, welcome to this week's information video. This week's topic is the history and current trends in mental health care and reimbursement. And there's going to be a lot of assignments online. You'll have videos to watch, articles to read, etc. Mary Elizabeth has prepared a PowerPoint that you'll be walking through, so I don't want to steal any of that thunder. I'm just going to give you a quick overview and talk about some salient things, some important issues that you need to know in this area. Earlier in the DSM psychopathology video, I talked about the church being responsible for mental health care in history. So for 1,000 years, mental health care was essentially done by the church because it was seen as, like I mentioned earlier, an issue of moral rectitude, an issue of moral issue. God is judging a person and therefore inflicting this whatever nastiness is on him or her, and that's what's causing mental illness, that's what's causing the depression or the hallucinations, etc. And that was the church's moral viewpoint, was that God was inflicting that on various people. Then through progress, the Sanitation Commission, the mental health movement joined with the medical hygiene movement, and mental health care began to turn a corner in the early part of the 20th century. Throughout the first half of the 20th century, there wasn't really much treatment for mental illness in the country, in the U.S., in the world. There were many asylums and sanitariums where people would be sent for a stay, and the average length stay was about 2 years. If you went to one of those places, you were going to stay about 2 years. Clifford Beers, remember in the intro lecture, I talked about Clifford Beers was depressed and he was admitted to a hospital twice, stayed about 2 years both times, because that was the average length stay back then. But they were beginning to take a look at medical interventions and beginning to understand mental illness as perhaps a medical issue and a disease rather than an issue of demonic possession or an issue of God's punishment because of moral issues or character issues. And so medicine began to take over dealing with mental illness in the first half of the 20th century. They noticed some phenomenological kind of things, that people who had things like, when people who had seizures, epileptics, rarely suffered from acute depression. They might get melancholic or they might get down, have the blues, but people who had seizures rarely had mental illness. So in the 1920s, they began to experiment with ways of inducing seizures so that a person might have relief from depression. They tried it with everything. They tried two different methods. One that was tried was insulin shock, where they gave the person essentially an overdose of insulin, and the person lapsed into a coma and was experiencing seizure activity. But they were killing too many people for that to be considered a good viable option. They tried it for a number of years, but wound up having a lot of people die from it. Back then, there wasn't a lawyer standing every 3 feet ready to sue somebody, and there weren't great ethical guidelines until the late 1940s, early 1950s. So killing people was just part and parcel of the business of medicine. I honestly remember my grandmother Lane refused to go to hospital. She had phlebitis, which is blood clots in her legs, and she would refuse to go to the hospital because hospital is where you went to die. And that was her viewpoint. She was born around 1900, might have been 1901, but something like that. So she grew up in the era where, medicine just routinely killed people. And so she just refused to go to the hospital, didn't like to go see the doctor, etc. Back then, doctors made house calls, and he would come to see her and treat her for her phlebitis and her blood clots that she would have and recur. And he would put her to bed, give her medicine, etc. But she just flat refused to go to the hospital because of that. A second method that they experimented with was electrical stimulation or electroshock treatment, electroconvulsive therapy, ECT. Now, it turned out that ECT, once they refined it, is safe. And believe it or not, there was a longitudinal study done in the 1980s by the National Institute of Health, a very reputable organization, did a study on 50 years of ECT, electroconvulsive therapy, and found out that it was indeed efficacious, that it worked really well for certain types of disorders. Now, it is a treatment of last resort. There are many medications now to treat depression and anxiety and psychosis, etc. But they didn't exist in the first half of the 20th century, and so people were resorting frequently to ECT, and they still do ECT. There's places in Atlanta that do ECT fairly routinely, and it's a treatment of last resort. When a person doesn't respond well to medication, they'll try ECT on them and get pretty good results. I was pretty much a non-believer until I was working in a hospital one time, and I had to help with one because they restrained the person, but they need 2 or 3 bodies to hold them still while they administer the ECT. And there was a lady that was just floridly psychotic as a result of depression. She was having psychotic symptoms as a result of depression. And we had to seclude her one time, and here's this tiny woman, honest to goodness. She was 5'4", 5'6", weighed about 130, 140 pounds soaking wet. And we had to put her in seclusion. Well, while in seclusion, she tore the bed apart and was using the metal side rail to try to batter the door down. Well, me and a couple other people had to go in through the door to restrain her because she was going to hurt herself or she was going to hurt somebody. And so I was first through the door. Being the biggest, that was always my privilege. And so I was first through the door. She swung the big side rail at the door, and I went through the door just as the side rail was in the down position, didn't give her time to raise it again, and wrapped her up in a big bear hug. And this little tiny woman did a Hulk move on me and separated my ribs from my sternum. And I couldn't let go because she was going to kill us if I let go. So I had to just hang on in agony while my buddy grabbed her legs and we got her across the bed, and the nurse came in and gave her an injection and calmed her down, got her sedated. But then they took her in for ECT a couple of days later, and 2 treatments cleared her right up. And it was the most interesting thing in the world. And I actually went in and observed. I was on limited duty, but I went in and observed, and I was surprised by the outcome. And I made a believer out of me, because this little woman who was going to kill everybody with the side rail of that bed, 2 days later was clear as a bell, apologized for doing what she had done, although it wasn't really her that was doing it. Anyway, made a believer out of me, and I do see it as efficacious treatment. But it's been around as well since about the 1920s and 1930s, when they were first experimenting with ways to do medical treatments for mental illness. Another one that they tried was what's called a prefrontal lobotomy, and we'll talk about it more in the brain. But your prefrontal cortex, which is right here above your eyes in the front part of your brain, the frontal lobe of your brain, controls mood and personality. And they began to notice, and I'll talk about this in the little lecture that I do about the brain, that people who had injuries to the prefrontal cortex tended to be calmer and more docile. And so they worked on this procedure to cut out the prefrontal cortex right in here through a couple of different procedures. One was they just went straight in through the skull right about here, in a procedure known as trepanning, that they cut a hole in the skull and cut out that. Another one was they took a probe and went up through behind the eye here and just kind of raked it back and forth and took out the prefrontal cortex that way. So some interesting kind of medical procedures. These videos will only do 10 minutes at a time. I'm at 9:35, so I'm going to stop now and go to a second video where I will finish up the information to get you rolling.